All right, so let's focus in on those troubling COVID infection numbers. 4,373 cases nationwide, 3,143 of them here in Gauteng. That is an exponential rise over the past week. Hospital admissions for COVID-19 are starting to increase in Gauteng as well. Younger people being admitted, most of those needing hospital care either partially vaccinated or unvaccinated. There are also reports of more babies in hospital due to COVID-19. Let's get a picture of how the biggest hospital in the country is doing. I'm joined by Dr. Rudo Mathivha, head of ICU at Chris Hani Baragwanath Hospital in Soweto. Doctor, thanks so much for joining us. So talk to me about what's happening at Chris Hani Baragwanath. We're seeing the numbers going up in terms of infections. Are you seeing COVID admissions starting to spike as well?
Well, first of all, thank you for inviting me and allowing me to share my experiences. By the way, Chris Hani Baragwanath Academic Hospital is the largest hospital in the Southern Hemisphere, not just Africa. Last week, we were talking about entering the fourth wave. And this week, we have picked up speed like we cannot believe. The number of ill patients presenting to hospital has increased exponentially. We are seeing definitely a change in the demographic profile of the patient. We are seeing children, toddlers, under 5, presenting with symptoms, and they're sick enough to require admission and to require supplemental oxygen. We are seeing 11-year-olds, 12-year-olds, 13-year-olds that are ill. Some of them have underlying diabetes and they need to be hospitalized. We are seeing 17-year-olds with severe infection, with pneumonia, testing COVID positive, requiring to be admitted to the COVID ICU and be mechanically ventilated. We are seeing trauma patients that are coming in and coincidentally testing COVID positive. And because of their injuries after surgery, they are unstable and they have to go to the COVID ICU or they have to go to the trauma ward. We are seeing an increased number of staff members testing COVID positive. Fortunately, most of the staff members have been vaccinated, so they're experiencing mild to moderate symptoms, and they can quarantine at home and take supportive treatment at home. But what I feared is happening. But I'm not saying people panic. The majority of the population will still get mild disease. But what is worrying right now is the shift in the age group that is being affected. Younger men, younger women, a lot of pregnant women presenting with symptoms at the hospital. You may remember with the first and second wave, the pregnant women were just coincidentally picked up to be COVID positive. Right now, they're presenting with symptoms and they need to be admitted. So there's a shift here.
I want to ask if that, sorry to jump in, but is this shift because older people, many of them are vaccinated? Or is it not just that? Are you suggesting, and we know it's early days, that A, this could be what Omicron is doing, and B, that younger people are more vulnerable? Or is it just that they're not vaccinated?
There are a number of factors. The first thing is, once the third wave seemed to have ebbed away, we all got relaxed and we behaved like there ain't no COVID in South Africa. We just basically stopped observing any measures of prevention. The second factor is we had our younger population being very reluctant to go and be vaccinated. And we had a very strong anti-vaccination lobby in our country, discouraging people to go and get vaccinated. That played a role. We managed to vaccinate the elderly people and the vulnerable people. So they seem to be protected now. And these are the factors. As to what the new variant is adding, I'm not a virologist, but I've always told my colleagues, I said, the big game changer is going to be the entry of a new variant. And I was saying that because in the third wave, when the Delta variant entered the picture, that's when we started seeing fireworks. Because we thought we had this COVID thing all figured out. We just go walk in the park and treat patients. And when Delta hit, it almost brought us down to our knees. And now there is something different. And I'm not saying it's Omicron, it's early days, but we are seeing the changes in the clinical environment. And something is changing. We know our youngsters have not been vaccinated. They have resisted to be vaccinated. And this is the time for them to actually get to the vaccination stations and be vaccinated. This is the time for South Africans to go back and observe the non-pharmaceutical interventions. One cannot overemphasize that.
Absolutely.
Vaccinate.
Absolutely. I'm sorry to jump in, but are you suggesting that the spike and the rise in COVID cases in children and younger adults is not just due to non-vaccination alone? You seem to be suggesting there's something more at play.
I am suggesting that, but as I said, virology is not my field of specialty, but I'm a seasoned clinician. And I have gone through 3 waves of COVID. I've seen the changes between the first wave, second wave, and the third Delta wave. And I'm suggesting there is a new player in town. And I'm also going to go as far as saying it didn't start here. What we saw happening in Europe, Israel, USA, when their numbers suddenly jumped up, they just did not check what was affecting them. Now, our good scientists actually did the genomics and said, aha, there is a mutation here. Let's share with the world. They shared with the world, and the world said, what? And that train is never late. The anti-Africa train is never late. They totally shut us out, as though we were in there brewing this virus. No, it was already all over the world.
I mean,
all we said was, this is what is plaguing us with this new waves.
Yeah, and it's so interesting that you say this, because we've just got news in the last few hours that the first cases of Omicron were picked up in the Netherlands actually on November the 19th, which is a full week before that plane flew in from South Africa with Omicron cases on board. One does wonder if those travel bans are now going to be imposed against the Netherlands as a precautionary principle, as they were against Southern Africa last week. But what you're saying then is that we've seen these spikes of cases in Europe, but because most people are vaccinated, it hasn't led to the hospitalizations. Are you suggesting that Omicron, because it's potentially going to be flooding a population that isn't vaccinated, and only 60% of immunity, the seroprevalence is not as high as it could be, that we could be in for a very severe hospitalization problem once again?
Well, it is not true that there were no hospitalizations in those countries. I have colleagues in the US, I have colleagues in the UK, I have colleagues in Europe, in Hong Kong. And I can tell you in the US, their pediatric ICUs were running at 90% occupancy rate. Their adult ICUs were packed full of COVID patients. And the same in Europe. The thing is, people are not transparent. But come to Africa, it gets painted really, really opaque. What is going to happen here at home, one cannot fully predict because one is not a prophet. But if this mutated variant is going to play rough with us, then we are in for a long, hard wave. But we can actually interrupt this spreading sequence by going to have as many people as possible vaccinated.
Yeah.
And observing the mask wearing, hand sanitation.
You're quite right.
Distance.
Yeah, sanitation, ventilation and vaccination, absolutely critical. However, let's talk very quickly hospital preparation. It's something you flagged last week as well. If we are indeed going to see younger people and children and babies potentially getting COVID-19, and let's not be too alarmist. It's very troubling what you're seeing, but of course we don't know where it's going at this stage, but it is very troubling what you're saying. When children get into ICU, they need smaller intubation tubes, they need smaller equipment. We need to be urgently making sure we have that equipment. At Chris Hani Baragwanath, are those preparations being made?
Well, Chris Hani Baragwanath Hospital has a pediatric ICU. It has a pediatric COVID ICU. It has a neonatal COVID ICU. So all those things are in place. We have the ventilators. The big question is, are we going to be able to handle the numbers? This is my concern. And Baruch Hashem, we will be able to handle the numbers. My worry is there is not enough pediatric ICU beds in the country, not just in Gauteng, in the country. Yes, you have a reasonable number of neonatal ICU beds. And our hospitals, almost all our hospitals, were not built to accommodate a lot of children. Because naturally, children don't get that sick to need to be in ICU for a long time.
And this is the change
Hospitals
that you are seeing now.
Yeah, this is the change.
Yeah, I just want to ask you, are you able to determine how many of your COVID patients in hospital at Chris Hani Baragwanath tonight have got Omicron? We understand that when you do the PCR test, it shows up with 2 lines instead of 1 if it's the Omicron. Do you have any understanding of how many patients you've got in your hospital with Omicron variant?
No, I don't know where the 1 and 2 lines come from. We use a polymerase chain reaction test, a PCR. That just tells you the patient has got COVID.
Right. So, okay.
To find out which strain it is, it has to go for genomics, for gene typing.
Could you give us...
You cannot know.
Right. Sorry,
Yeah.
sorry to interrupt. Could you tell us how many people are in hospital with COVID-19? How many of them are children at Chris Hani?
At the moment, the pediatric COVID ward is full.
So that's how many?
And that's ward 39. When we spoke this afternoon, I think we had between 15 or 17 patients.
Sure.
And we were already talking about creating extra accommodation for pediatric COVID patients. And this was not including PUIs, so people under investigations, those that were being suspected of maybe having COVID and they were still waiting for test results. On the adult side, the COVID wards were full that were on the general side of the hospital, and we were already talking about moving patients to the ABT structure. I'm sure you are familiar with the ABT structure. It's the alternate building technology structure that was put up during the first wave to try and act as an overflow capacity structure for the hospitals.
So how many adult COVID patients do you have tonight?
I would be lying if I gave you a number, but if we talk about the Department of Internal Medicine that has 800 beds, and we've taken away half of those beds and given them to COVID patients, that gives you an idea.
Yeah.
And then we have a smattering of surgical patients and trauma patients that have COVID, and we're trying to accommodate them in those repurposed beds that we have repurposed for COVID. That's a fair number of patients.
That is indeed.
And we're already trying to decant into a 500-bed ABT structure. And we don't have staff to look after all the patients. When last week I said, I don't think we are ready. We don't have the human resources. Not enough nurses, not enough medical officers, not enough specialists, and quite a number of healthcare workers are down with COVID as well.
How many COVID patients are being ventilated at Chris Hani tonight?
At the moment, we've got 4 being ventilated, and then we've got a few on supplemental oxygen. And the 4 that are being ventilated have lower respiratory tract problems, so pneumonia. So this is not like we just intubated the patient just for the sake of ventilating. This COVID has actually done a number on their lungs. So, and the youngest one in that COVID ICU is a 17-year-old male.
With comorbidities?
That is worrying.
Any comorbidities for that 17-year-old?
No comorbidities. That is the other thing that is worrying. Comorbidity.
Do you think one vaccine is enough for children over 12, or do you think they should get 2 doses?
You know what? We as healthcare workers were given booster doses recently. I think, to be fair, and if South Africa can afford it, everybody should have a booster shot. And we should actually just start vaccinating the children. I don't know what dose we use. This is where I get lost. I think we should protect the children, but how do you work out the dose? Because the studies were not done on children, but we know that children get other types of vaccine and they tolerate them well. But this is a new technology vaccine. But we need to do something to protect the children, the young adults, the teenagers, and then all those elderly people that we vaccinated that have comorbidities that are vulnerable. All immunosuppressed people that may have had their first vaccines that are vulnerable need to be topped up. This is the only way that we are going to interrupt the spreading sequence of COVID, and then observing the measures not to give it to each other, wearing masks and sanitizing and social distancing. So I know I'm like speaking like I'm in utopia, but we need to protect South Africa now. And we needed to do it like yesterday, but we can still catch up. And the virologists will tell us, they've already identified how many mutations are on the spike proteins and what the relevance of that is. How are those mutations going to make this virus behave? We in the clinical field will share with them what we're seeing, what the virus is doing to the body. I mean, we don't have any drug to kill this virus. We can only give people supportive therapy.
Yeah.
but the power is in the hands of the people to stop the virus spreading. And not in a panic mode, just steady but sure, steady but sure, knowing what we're doing.
Yeah, well, Doctor, you have given us a very real insight into what is going on in your hospital. Thank you for taking us there so that we can get a real picture. Dr. Rudo Mathivha, Head of ICU at Chris Hani Baragwanath Hospital, thank you for your time. Telling us that the pediatric COVID ward is full this evening. That has 15 to 17 young patients. And in the ICU, their youngest person in ICU with COVID is 17 years old, no comorbidities at all. She is ringing a very loud alarm bell, but also telling us vaccinations have to happen. It is a very chilling interview and very worrying news indeed. And of course, there's so much we don't know. But if what is happening at Chris Hani Baragwanath is any indication, and from what the doctor is telling us, and as she says, she's lived through 3 waves, something is afoot. Something, it's not just that young people are largely unvaccinated. She believes there's something else at play.
Definitely concerning that she's again saying that they don't have enough medical staff, because I interviewed her last year and she was saying the exact same thing, and she was asking for the appointment of nursing staff in particular to be sped up because there was a slow process there. And she's saying the same thing now as we enter the 4th wave.
Well, Shahan, you know, I think the important thing is, if you look at the COVID numbers and how sharply towards Gauteng they are skewed, we need to move urgently to get hospital staff from other parts of the country to Gauteng.
Yeah. All right, we will continue unpacking this variant over the next couple of days and weeks on South Africa Tonight and on eNCA as a whole, because it's not going anywhere. We're going to learn more about it, and we'll bring you every bit of information we can so that you can make informed decisions.